Ma'am would like to have an interaction now that there are common ophthalmic procedures. What about the cornea? What you'd like to highlight? The procedures. Okay. Can somebody give her the mic? We can hear you, but it's always, the things are getting recorded, so it's always better we have a proper conduct of the session. Yeah.
So,
just introduce yourself again.
Good morning. I am Dr. Deepthi from Gulbarga. I work in Anugrah Eye Hospital, a trust hospital.
Okay.
So we are a group of 5 ophthalmologists at that hospital.
I see.
So various subspecialties: retina, pediatric ophthalmoplasty. I am dealing with cornea phaco-refractive. So basically, when you are in a tier 2 city, it's a tier 2 city and quite not that near and that far from a metro city. Hyderabad is the next nearing city, which is like around 200 kilometers or something. So when you are in a common for a common ophthalmic practice there, I would say in cornea to have a ophthalmic microscope there, ophthalmic compound microscope. You know, I got it. Like when you're doing a routine scraping like KOH and gram staining, it's very useful. Like instead of sending it to a microbiologist lab, which would be like my hospital is around 7 kilometers away from the city.
Okay, so it's very difficult to send it for pathology and all.
Lab will take me around 10 minutes for the patient to go. There is no proper bus facilities or auto facilities for me to send the patient there, and then that lab they will have all those blood investigation, other things going on, again another delay of 2-3 hours. By the time the patient gets back to me, it will be around 3 hours. 3 to 4 hours. In that time, he will lose the interest of taking the treatment.
Absolutely.
He'll be just telling, oh, I came here, the doctor sent me off for the investigation, and I went there, and there is no treatment. And it just makes him go to some other place.
Absolutely.
Where 2 chances. Some other better place, to a better city where everything is there at one thing. Or to some other person who would just put on an empirical treatment rather than focusing on what exactly it has
instead of
to be done.
investigating and finding out.
Yes. So just doing a KOH, which is like 5 minutes procedure.
Absolutely.
Just sit in the OPD, do the scraping, do that KOH and gram staining. You can do it by yourself, or train a simple technician who can do it, or your fellows, whoever is there can do it. Just 10 minutes. Like you can put a dilating drop for the patient, make the patient wait for 10 minutes, and then it is done. So you will get in, an instant thing, whether it's, there is a fungus or bacteria, yes, but there is a fungus or not, you can just treat there. And
very important point that you have said, especially in the rural part of this. If you have a simple microscope, it goes a long way in
and it is very easy.
diagnosing, especially the common fungal infections, where just a KOH is all that is required.
Yeah, and it is very simple, 10 minutes, and you can see those translucent. Once you see that KOH, you will not forget. I mean,
what are the other procedures that you do commonly for the benefit of the other participants?
One thing, slit lamp photography also. I would say slit lamp photography also is very important. With your routine phone, you can just use the adapter and do it to document things.
Yes.
To just say to especially when I deal with this ulcer patient, to tell them, this was when it is like this, now it is like this, and it takes 2-3 months for you. 2-3 months before it was like this, so your infection has come down, your scarring is coming down, or something like, to just interact positively with the patient. Or sometimes when the patient is waiting long, and you can just cool them by telling, see, this was how it was before, and now it is like this, it is like this. I think documentation using photography,
very important.
That is very important.
Cases of cornea and all, especially even for medical legal, it's very important. You have XYZ disease. If you document it and after treatment, the patient says, "Nahi, mere ko to kuch theek nahi lag raha." You can always show the photographs and see that how at least anatomically you have achieved the result. Kya hota hai? Corneal opacity, central corneal ulcer. The patient has PLPR vision, but after the healing again he has that vision. But he hasn't realized that the redness, pain, pricking, photophobia, everything has gone. भाई मेरा नज़र ही नहीं आया सर, आपने तो पूरा ट्रीट किया. You've been treating for almost 2 months. So it's very important. Small little point made by ma'am. It's very good, sir. Please share this thing, what common ophthalmic procedure you do in your practice. I would like all the participants to give a view, a broad eye view, what exactly do you do. Sir, introduce yourself first.
Yeah, good morning, Dr. Taswala. I am Dr. Aman Mittal.
Yes.
I am an oculoplastic surgeon from Punjab. I basically practice in Amritsar and Chandigarh.
Yes, sir.
So I have my own hospital in Amritsar, and my wife is a plastic surgeon, so we have an eye and plastic surgery center there. In Chandigarh, I work in a way that I have a multi-speciality center where I have sort of rented out a space for my OPD, and I use their operation theater and infrastructure logistics, so that I don't have any infrastructural burden on my mind.
Right,
I just
right.
go see my patients. Patients are mine own. See my patients, use their theater for doing surgery. I have my instruments and everything placed for myself. Use their staff and pay them whatever their rent is. So that
Mithil
actually,
sir, we want a very important thing is in oculoplasty, what are the common ophthalmic procedures that you do,
Yes,
which
I'm-
is helpful for even a person from the rural background,
yes,
a person
I'm coming on to
practicing.
that. Oculoplasty can be broadly divided into three components: adnexa, orbit, and lacrimal system.
Absolutely.
So in adnexa, we have lids, eyebrows, upper mid-face, you can say, till forehead. So all those traumatic related, cosmetic related conditions like any dog bite, roadside accidents, blepharoplasties, brotosis, entropion, ectropion, any lid pathologies, all are covered into oculoplasty. Second is dacryology. So in that, all epiphora related problems, punctum related, canaliculus, DCR, DCTs, lacrimal tumors, everything is done. In orbits, I do all the type of orbital fractures, orbital tumors, orbitotomies for everything. So oncology is also part of my specialty, which deals in any lid or ocular surface or even orbital tumors. So all those oncology part is also taken care of, even intraocular tumors like retinoblastomas and choroidal melanomas. So this all is basically done. Aesthetics is another addition which we are doing for the last 1 decade, which includes Botox, fillers, and surgical procedures of upper mid face. Being plastic surgery, my wife is, so we do full face and even body also.
Very
That's
good,
all.
sir. Very nice. Dr. Mithil has given a highlight, I mean, in short overview of what all are the common procedures that you do. And even at the, you are in Dehradun? No, sir. He is in Amritsar. So it's a tier 2 city. He has been managing all these procedures there. So can you help us in telling us for the other participants, in say for blepharoplasty, how would you go about it? Just from step by step, so other people can take
Yes,
it
sir.
up and do it as a common general ophthalmologist also should be able to do it.
Blepharoplasty first, whether it's a choice of the patient or whether it's a need of the patient. One is a
It's the
cosmetic
need of the patient, you
blepharoplasty.
take it that way and then we do.
One is a cosmetic blepharoplasty where the patient comes like, I am having a baggy eyelids, lower eyelids, or we are having
Hanging
a drooping-
eyebrows.
Any eyebrows or even
In the
eyelids.
upper eyelids, yeah.
Yes, they are sagging or they are fats in the lower lids. So we can remove those saggy lids. We can increase the height of the brow by doing browplasty. So that is by giving an incision, skin muscle excision over the eyebrows or doing some forehead procedures and lifting the eyebrows. Second is blepharoplasty of the lids. In upper lids, we mark the lids, how much is excess, and we remove it, leaving around 20 millimeters from the eyebrows to the lid margin. That is the minimum which should be left so that there is no lag of thalmos or nocturnal lag of thalmos. Skin muscle plus, if there is excessive fat, the fat pads needs to be removed and sutured in layer. And lower lid is slightly tricky in that we have not only to remove the lid bags, the fat pads, but sometimes we also need to take care of the laxity part. So we tighten the lids as well. Now we remove the fat and also reposition the fat along with. So that can be done from the skin approach as well as the conjunctival approach. So in these all things, the setup which we require is ophthalmic plus we can do it in general surgery setup also. So that's why in Chandigarh, where I do in a multicentric specialty, there it's a general surgeons theaters, orthopedicians, gynae-obs, surgeons all share. But because of mine being an extraocular type of specialty, so it's very convenient for me because I do with infective as well. A lot of blood is there, which we don't like in our ophthalmic centers, but there they don't mind because still my blood is less than what they spill over.
Absolutely.
So that is the way it is. I hope it answers what you
Yes,
wanted me to
absolutely. Thanks a lot, Dr. Senthil. Yeah.
Can I start with the presentation?
I just want to ask something, oculoplasty thing only. Just then, in a routine, when you have a general DBCS camp patients and all, how effective you think is ROPLAS, what we do here, to evaluate the sac syringing when you're doing an, oculoplasty procedures?
Didn't get completely there. You mean if I'm doing an external surgeries, do I still need to do a sac syringing? I would divide this question into two. One is for intraocular surgeries. My take is there are two schools of thought. One says that you just do a Rho plus positive and negative and go ahead with the surgery if it's Rho plus negative.
Yes.
But being an oculoplastic surgeon, I have seen so many times the Rho plus is negative, but there is an NLD obstruction, there is a blockage. So there is always a potential space which can get infected and can cause endophthalmitis or other complications intraocularly. So my take is, if you have an oculoplastic person attached to you or where you can refer, get the DCR done, be on the safer side, then go in for an intraocular procedures, right? From the external surgeries, again, any infective focus should be taken care of. So if I have an NLD obstruction or any infective focus, I would love to remove it and then do an extraocular procedure, even if it's an extraocular or intraocular, so that my conditions are not getting infected. But if it is a condition where I have to do a procedure because the infection is there, so infection has to be taken care of, then of course, even in an infective condition, I have to do it, like in abscess, in DCRs, in NLD obstructions, or even some, some pockets of infection which need to be taken care of, like canaliculitis, where we have to intervene when it is already an active infection phase.
Fine, sir. Thank you. Now we have actually Dr. Senthil. Everybody must be aware that he has that ophthalmic practice development group, and then it has bifurcated into multiple groups, right from buying of the equipments, then how to do insurance, then finance, and so much of it. So he would like to speak on think like an entrepreneur and increase patient footfalls. So over to you, sir, Dr. Senthil. I think 10 or 15 minutes should be good enough. Yeah,
Anyway,
that's nice.
Can I
So
have
it's
my
been an
other
interesting
Can I
topic.
have my other presentation? There is one more, no?
Actually, you have to.
Yeah.
Okay. In the meantime, any queries you have? This, okay, fine. Start, sir.
So thank you for all the people who are here. I think we thought we'll be not having any participant.
Yeah.
So let us forget, first thing is, please forget whatever you learnt in the last 2 days about ophthalmology and cataract surgery, extraocular, intraocular, all these things, because whatever I'm going to talk over the next 15-20 minutes will not have anything related to ophthalmology, because what you have learnt is basically skill based, like how do I do a good cataract surgery, or how do I do a good lacrimal gland surgery, but skill alone is not enough to reach a scale. So there is a difference between as an ophthalmologist, when you start working or when you start doing surgeries, you are mostly skill dependent. But how do you kind of create a larger kind of an enterprise? Because you cannot create a larger enterprise by being an self-employed person. Because I don't know if you have learnt about this cash flow quadrant by Robert Kiyosaki, where you can divide people into 4 quadrants. Like any professional, you can divide into 4, or any kind of people we can divide into 4. One is an employed. So when you work for somebody, you are employed. So you work for a hospital, you work for the government, you are an employed person. Second thing is self-employed. So when you start your own clinic and then you start working on that, so you think that you are starting a business, but actually you are self-employed, because you are seeing patients every day, you are doing the surgeries. So in a self-employed, the risks are minimal, but the ability to scale up is also restricted. So the third quadrant is entrepreneur. So when you start multiple hospitals and employ other people in your hospital, then you become an entrepreneur, where you have a business system which is going to generate revenue for you and do the create that legacy for you. The fourth quadrant is investor. So when you are investing in somebody else's business, so let's say you buy shares in Center for Sight, or you buy shares in Agarwal Eye Hospital, or even another unrelated company, so you become an investor. So the most successful, skillful people are who are mostly investors, but basically you can be part of all the 4 also. You can be either employed, you also have your self-employment, you be a part of a business, and also you can also be an investor. So So what if everything we have been taught right from the beginning of our life, like you study well, you can do well in life, you be the first in everything, you can be the best, you become the best surgeon, you can be the best. But what we understand as we go ahead in life is like see who are the most successful. I'm not meaning success only by the way of revenue generation, but who has created more enterprises, more legacy. Even in our classes, I think the last benches whom we thought that they will never become successful are the people who have become more successful. They have created legacy. So whatever we have been taught, let me be the best surgeon, let me be study well, let me be the first, let me be the best. Actually, whatever we are taught in life that we will succeed is actually wrong. So basically, I'm not contending that being a doctor is wrong, but a lot of things doesn't work in reality. So I think we need to have that mindset change if we really have to succeed in life. So in fact, we think that okay, if I become an oculoplasty surgeon, or if I become a neuro-ophthalmologist, or if I specialize more and more, am I going to be more successful? But actually it's the reverse. If you see, most of the time the general ophthalmologist succeeds more than a specialist, or most of the time the MBBS doctor succeeds more than a specialist doctor. In fact, the largest of the hospitals are being run by non-medical people, or even people who are MBBS doctors. Like Apollo Hospital, Dr. Pratap Reddy doesn't practice, or even largest eye hospitals, I think majority of the doctors who run the hospital are not practitioners. So lot of things which we think that we have been taught to succeed in life is wrong. I think if we have to start approaching life from that way, I think it is easier to create that legacy and success. So, and these giant sequoia trees, you see these big trees when you get into the forest, many of them are not grown in a single day. So it takes lots of years. Even the mountains have been created over millions of years. So lot of enterprises also take a lot of time to develop, and this concept is called quiet compounding. So it's not that these large institutions like LV Prasad or Shankar Nethralaya, they have not been developed in one single day. Or so basically for you also to develop, I think you have to change that mindset from being a skill-based practitioner to a scale-based entrepreneur. So if you see people who have created these large organizations, they are more entrepreneurs than clinicians. So if you are right now, I spoke with one doctor. He is building a 30,000 square feet eye hospital in a place in Maharashtra. So I told him the first thing is he has to, till now he has been a clinician till he starts that building. But after he starts a 30,000 square feet, I don't think as a single person he will be able to satisfy the needs, and maybe there should be a potential of 200 to 50 patients coming in a day. So he needs to think about how to change himself from the clinician into the entrepreneur, and now he is 35 years of age. So he needs to think that how do I grow like this sequoia tree? Maybe when he is 65 he needs to have this large institution, and it takes a lot of time, lot of effort, lot of skills also, which a doctor also needs to accumulate to have this quiet compounding. So other biggest problem is, right, even before we started this session, most of the time we were thinking about what we are doing and how I do my surgery or how I get oculoplasty patients. But I think that is, we should also spend a lot of time about what we should be doing to have that larger vision in life. So if you follow Naval Ravikant, a lot of the times there are certain concepts which he thinks that, so there is a difference between working in the business and working on the business. So working in is like you go into your clinic every day, you see patients, you do surgeries, that is working in the business. But if you have to really create a larger enterprise, you have to start working on the business. So how do my practice, what do I do after 5 years, or how do I convert my single practitioner clinic into a 5-doctor clinic, or how do I convert my one surgical location into 10 locations? I think you should start working on the business. So basically majority of the times our time is spent working in the business. So as a doctor, I think people who are more enterprise creators are people who have started working on the business. So you need to move away most of the time. Let's say 80% of the time you still focus on clinical ophthalmology, but maybe at least 20% of the time you should start working on the business. So you should be thinking about what you should be doing. So, and think in a corporate way. Even if you have a small clinic now, but what does it take for you to corporatize that clinic? What does it take to think like a bigger organization? So, if you had listened to Dr. G. N. Rao's talk during the inaugural session, so he brought in a lot of points like how do you incorporate tele-ophthalmology, how do you collaborate with people. So, basically start thinking as a corporate organization right from the beginning, and a corporate organization meaning it has to be a private limited company, and then you have to bring more professional market insights. There should be processes involved. So even if you are having a single person clinic with 2-3 staff only, but even from those time also you can think in a corporate way. So what are the processes which an organization like Center for Sight be having in my hospital? So why don't you think that way? So if you start thinking as a corporate, even when you are a smaller organization also, I think that is when you will really become a corporate after 10 years, 15 years. So it will also include establishing a leadership board, introducing processes such as audit, accounting, HR, marketing, sales, technology. So all these things have to be brought into that organization if you have to think of growing, and if you want to move from a skill-based person to a scale-based person. So basically as one doctor we are limited because we can only see so many number of patients in a day. But let's say you can see 30 patients in a day, but how do you equip yourself, add up more doctors so you can see 300 patients in a day? So your time can be, if you have 10 doctors, 8 or 10 doctors collaborating with you, I think you have that. Even if you have limited time of 10 hours only every day, but the scale of what you can do can be improved. I think another important thing is you need to really understand your business model. So business model is based on volume, margin and growth. Volume is number of patients you can see, margin is what is the profit margin you make, and growth, what is the growth you have. So every business will rotate on these lines. So you have to apply this VMG filter, volume, margin, growth filter. So there are certain products, for example, let's say toothpaste. The volume is high, the margin is high because Colgate is a big brand, but growth in that segment is low because there are only so many number of people, they can only brush once a day or maybe twice a day. So the volume is high, margin is high, but growth is low. On the other hand, there are some businesses where the volume is high, for example, financial advisory services or technology companies. Margin might be low, but the growth potential is high. For example, if you take mutual fund advisory service, so now only 6% of the population is buying mutual fund. So there is a huge potential to grow. But the medical practice, the problem is basically you are limited by volume because you can only see so many number of patients in a day. And your margin is decided by other people. So you cannot charge 2 lakh rupees for a cataract surgery because it also depends on the surrounding, what is the other person charging. Growth can be high, but if you want to focus on that high growth, I think you need to focus on scaling up. And there are other products which there is a low volume but high margin, high growth. For example, a BMW car. But there are only a few doctors who can charge that premium. So how many doctors in India charge 2,000 rupees as consultation fees? Or how many doctors in India can charge more than 1.5 lakh rupees for a cataract surgery? Maybe there are 10 people, 15 people in India. So basically you have to focus on the middle segment, understand that there are limitations in a clinical practice. Basically the volume is limited because we can see so many number only, and the margin is also low. Only way to scale up, only way to improve is collaborating with other doctors, collaborating with other people, and only if you collaborate, I think you can grow. So the mindset has to change. We have to understand our deficiency and use it to our advantage to scale up. I think I have not confused you, no? You understood this point. So applying this VMG filter for every kind of business is very important. So how do you scale up? So scaling up from 100 patients or 20, 50 patients in a day to 100 requires a very clear vision. So, and then like, what do I want to become after 5 years? What do I want to become after 20 years? Or how do I exit my practice? And having this vision is very important, and having a clear vision and what is the key ingredient of this vision. So basically it's not I wanted to be the best surgeon, I want to do the toughest of the surgery, need not be the key ingredient. But your key ingredient can be, oh, India has only so many diabetic people, so how do I reach a larger number of diabetic population? So something like that, which is a broad based vision, is important. For example, as a single person, you can only build a tent kind of a thing. So maybe most of our hospitals, most of the individual practices in India are run by single practitioners, but under his own control and guidance. But if you want to build this larger house, which is like a corporate hospital, you need a collaboration with lot of people. One person cannot build this larger kind of a house, so larger mansion. So to do that, you need to collaborate. So as a single clinic, and if you want to be an institution builder, I think you need to collaborate, have the usage of lot of more colleagues, lot more technology, lot more experts, lot more processes, everything has to come into place. I think this is the most important slide. This is also from Naval Ravikant. If you are earning with your time, like going to your clinic every day, your growth can be on the what you see on the left side. So basically you are renting out your time. You can only earn, or you can only develop as much as your time. So if you are not going to the clinic for 1 month, so you will not be having that earning. So majority of the time we try to earn with the time, but how do you think of earning with your mind? So the successful entrepreneurs have thought of how do they collaborate, how do they create systems which can help them earn with their mind. So I think this is something which we have to take it into consideration and understand that most of the time as ophthalmologists we are earning with our time. So we are no different than please don't mistake me. So we are no different than a plumber or an electrician or a highly skilled technician. So we rent out our time and we earn with our time, and in this process we don't have time to do whatever we are passionate about, because many times we fool ourselves, many doctors tell, oh, for me practicing is the best thing, surgery is the best thing. Okay, but seeing patients and surgery is not the only thing needed in life. So there are doctors who are 70, 75, still they keep operating, but maybe there are other facets also in life. Why should you only keep operating? Why should you only see patients? So think of how can you earn with your mind. I think if you can get this concept, go home and think about this point, and if you can think about earning with your mind, that is something I think I would have driven the point to all of you. The other important thing which we fail to do is leverage. So basically this big block of iron cannot be lifted by this woman, but when you have a pivot, you can leverage. You can use that pivot as a leverage. So even with less effort, you can lift a heavy load. So there was this king, I read recently, there is a book called Obstacles Are the Way. So there was a king who put a big block of stone on the way to that kingdom. So he thought, how will people handle it? So many of them were coming, trying to push it, and then they were all cursing the king, until one farmer or a peasant came and he used a big rod to move that boulder of stone, and he found that under the boulder there was a pot of gold. So basically we can use leverage. This OP is very important, other people. So this is also an important slide. I think you have to concentrate on this. So OP is other people, so you have to start using other people's time. So basically you get experts, get your friends, get your colleagues, get other doctors, make them work for you. I think you have to be selfish and make them use other people's time. OPM is other people's money, so you cannot use only your money to grow. All these larger organizations, they have always used other people's money, either it's investors' money, or either it's money from banks, or maybe donated money. So you also have to find out ways to use other people's money. OPK is other people's knowledge. So how do you employ more people who are more skillful, more talented than you? And OPS is other people's skill. So you may be a cataract surgeon, but how do you use the skill of oculoplasty or retina surgeon? Or OPE is other people's effort, OPI is other people's investment. It is almost similar to other people's or other people's innovation. So it is like, I don't think there is anything shameful in this. I think you have to start thinking the most successful enterprises are created by using OP. So the more you use other people, the more you can grow. So don't use only yourself, your skill, your time, your money, your knowledge. Think of how do you use the knowledge, skill, time, money and everything from other people. So if you can leverage, I think that is when you can actually grow. So other thing is inspiration, and so we get inspired to do a lot of things. Basically, let's say you want to start a new facility, or you want to start consulting in another hospital, or you want to start investing. So the problem with inspiration is always perishable. Let's say if you postpone it by 1 week, so you don't get that inspiration. So basically, whenever you have that inspiration to do something, you have to start acting upon it immediately. So you can be impatient in your action, but patient in your result. So basically, start working on it, whatever you think you want to do. So tomorrow you want to, maybe there should be a logic also. I'm not telling you have to take a huge loan to start a 50 crore hospital tomorrow, but even smaller things, like you plan to attend a management workshop, or you want to do a staff training, or you want to equip yourself, or you even want to travel somewhere. Whenever you have that inspiration, you have to act on it immediately, because inspiration is many times perishable. So if you think about it for 1 week, 10 days, 15 days, then you lose the interest, you forget it. So be impatient in your action, but don't be patient for your results. So act immediately. Results as the sequoia tree comes will take time. So some interesting, I think majority of the time I lost a lot of projects because I get inspired to do something, but I don't do it. So then I postpone it. I just keep delaying it for a month or so. Then I think majority of the time it goes. Something very important, which I think all of you would have observed. So whenever you get inspired, act on it immediately. So other common myth we have is, whenever we start a hospital, we think that we are running a business, but actually we are not running a business, we are in a self-employed profession. So because you are really running a business when you have these systems, processes, other people, everybody working. Even if you don't go to the hospital for 1 month, your business should run properly, revenue should be there on the same way. Or you have these 10 multiple hospitals, there should be a system and process which is working on it, where you can kind of the organization still runs. I'm not telling that everybody should be starting your own hospital. I'm not telling that only if you are starting your own hospital you are successful, but even if you are running a smaller clinic also, but maybe you think of running it in a professional business kind of a way. I think that is important, because everybody is not made to run large enterprises. Maybe people are there only to be employed, still it is good, but people are self-employed, that is also fine. But if you are in any kind of segment, wherever you are, you can still apply these concepts and create your own legacy. So that is important. So if you are running your small eye hospital, I think in India there are 6,000 to 7,000 smaller eye hospitals. Majority of them are self-employed businesses, and they are not really an entrepreneurial business. So you need to understand that. I think this I already explained. So be impatient with your actions. So the results will take a lot of time to come, and be patient for the results to come. So another biggest problem, we want to do everything ourselves. So if you are also having that mindset to outsource a lot of things in your practice, like even the HR management or your staff management, if you kind of outsource a lot of things, you have time to scale and grow. So other biggest problem is we are also not, we see everybody as a competition. So basically we don't want to collaborate with other doctors because we see the next person or our colleague always as a competitor. So we should always think, move on from that mind of competition to collaboration. So the biggest of the organizations have been created because of multiple collaborations which have been formed by a lot of people. So for example, I think Dr. Devanshu studied in Spain. So Spain, there is this largest pediatric hospital which wanted to start a pediatric campaign. They wanted to do a marketing campaign. This is an example to say that you can collaborate with anybody. You don't have to collaborate only with doctors. So this hospital wanted to create a huge, I don't know if I have that picture. Okay. So this hospital wanted to create a marketing campaign for the children, and then they thought of, so normally a pediatric hospital, how do they think is, maybe they will think, okay, let me organize pediatric camps, let me collaborate with other physicians. So this hospital thought in a different way. So they thought, why don't we collaborate? Because the biggest problem children were having in Spain is just like what we have in India. They were carrying these heavy bags to school, and there was spinal problems. The parents were always worried that, oh, my child is being made to carry such a heavy load. So they went to this biggest bag maker in Spain called Miguel Rees, and they said, design a bag which will put less strain on the spinal cord of the children. So then the hospital, I cannot pronounce the name of the hospital, they started collaborating with the bag maker, and they started a marketing campaign where they said, we are now concerned about the spine of your children, and they started a huge marketing campaign which became very successful. So meaning we can collaborate with anybody. It's not that we have to collaborate with only doctors. See, if you see a large organization like LV Prasad, they have grown because they have these multiple collaboration with multiple people. For example, they collaborate with Microsoft in developing that artificial intelligence. They have Google collaboration. They have collaboration with the equipment manufacturers. They collaborate with NGOs. They collaborate with government. They collaborate with schools. Lot of collaborations which are quite different, not only with doctors. So even as a smaller hospital, can we collaborate with the diabetologists? Can we collaborate with physicians? Can we collaborate with opticians? So maybe can we even collaborate with organizations, charitable or non-profit business organizations? So if you think of collaboration, I think that is when you can really also scale up what you want to do. So from skill to scale, if you want to move, I think collaboration is the way forward, and collaboration with multiple non-competing different entities also is possible. So I think this is also an important slide, basically from Naval Ravikant. So when you are working for somebody, you are renting your time. So you are not having equity in the business. If you really want to be successful, I think whatever you have or you put your effort in, you need to own a small piece of equity. So let's say you work in an organization. Let's say even if you work in a, for example, if you are working in Titan Industries, but if you have shares of Titan, I think that will give you more value than whatever you make as salary. So whenever you are thinking of working with a hospital, even if your salary is lower, but can you get a percentage of the business, say 10%, 20%. So if you are having a ownership, because when you are working for somebody else to create his brand, somebody else to create his IP, and somebody else is going to take all the name and benefit of that business. But if you are owning an equity, so let's say you even work in a charitable organization, but if you can also become a part of the trustees. So I think if you can think of those ways, that is when you create a larger organization. So whenever, I think apart from your initial 4 or 5 years of practice or working, I think if you move on from that way, wherever you work, even if you get a lower salary, but you should see either create your own organization or have equity in that organization. So it need not be, I think many of us are now working in these corporate hospitals where you don't get anything other than your salary. So maybe the salary is attractive initially, but you are actually working for them to create their brand, create that valuation. Maybe he will sell the organization for 5,000 crores, but you will still end up with the salary. But on the other hand, work with a smaller practitioner. Like yesterday I was talking with one doctor in Bhavnagar. So he said, if some doctor is willing to come and work for me, I am ready to give 50% of my practice, which is already an established practice. So I would always prefer that instead of working for a larger corporate, work for somebody who can give you an equity in your business, or you create your own business where you own 100% equity. So basically you are the owner, you become the investor, and that brand also, you are going to build that brand which will be valuable. Because at the end of the day, many doctors, they keep working for 30 years, 35 years, but are they able to create valuation for that brand? Unless it's being sold to some corporate, and corporates don't buy all hospitals. Corporate buy organizations of particular scale. Only if you're having say 50 lakh turnover in a month, something like that is what is attractive for them. So on the other hand, if your children are not becoming ophthalmologists, you are working all your life for something, but in the end you are not able to monetize on that. So some optician in your place may have this optical shop which he can sell for say a larger amount, but we may not be able to sell the practice. We see many doctors, they create something, they work day in and day out of their practice, but at the end of the day, after they die, if children are not ophthalmologists, they just get the depreciated value for the equipment. So I think it's important to think about exit options and legacy creation also. So own equity. So if I were, I would like to work for somebody, I will say, okay, can I have a percentage of this organization? So and you need to create, either you should be a good leader, or you should create a leadership, or you should be able to employ leaders who can inspire your organization, have this culture created, and the leadership should be able to communicate the vision of the organization to all the employees. So this can be even a small clinic and you are the leader in the clinic, but are you inspiring your people every day, and are you having a culture which is in your organization, and are you communicating your vision to the people working for you? I think it's also important. So creating that leadership. And you cannot do anything alone. I think the biggest problem with the doctors is we think that we should be the smartest person in our organization, but actually if you are the smartest person, it is not that you are building a larger organization. You should be able to employ people who are more skillful, more smarter than you, better doctors than you, and you should be able to manage them. And unless you have a team, you cannot build a larger organization. So the team as you have a bigger and bigger team, I think you are going closer towards building a very large organization. And understanding the difference between what is a team. Team is somebody who always think together, and they are all thinking about the growth of that organization. But a staff is somebody who just works for a salary. So are you really having a team, or are you having staff who are working for you? So this is also important. And establishing these systems and processes, having a software, having good regulatory systems in our clinic, spending a little bit of money to have that digital infrastructure is also important, and standard operating procedures. So even if another doctor comes into your hospital, he should be able to do whatever there without you being there to guide them. So if you want to build a larger organization, I think systems and processes are also important. Finally, you have to think about, okay, I am building this hospital, and what is it going to be? Is it, there are two things we work for. One is a legacy creation. So will this organization tell my name even after I die? And that is a kind of a legacy creation. And second thing is valuation, because valuation, what kind of a value my organization will garner, and whether my children can get that money, or children can get the benefit of whatever I have created. And for this legacy and valuation, you need to have a good management team. You need to manage that management team, and that management team should be properly managing the business. And finally, you should become invisible in your business. So what I mean by invisibility is, like, even if people come to your hospital, they should not be asking you for your name, but they should be coming for that organization. So for example, LV Prasad, nobody goes and asks for Dr. G. N. Rao. They go for the name of LV Prasad. Or Apollo, nobody goes for any particular name. So if you have to move from skill to scale, you have to slowly become invisible from that whole organization, and then the organization should get the name forward and you should become invisible. And most of the time in our practices, we are the most visible person. If the doctor is not there, nobody comes to the hospital, it is deserted. So how do you think of becoming invisible? So, and leave that ego that I should be the person who is smart in the hospital, I should be running everything. If I am not there, everything should get closed. Then you are not creating this skill to scale legacy creation. So it's important to think that way also. So these are my contact information. I hope I have not offended you in any way, and maybe I would have if I can create some different thought process even in 4 or 5 people, I am sure the purpose of coming from Chennai is solved.
Fantastic. Very nicely put up, Dr. Senthil. And what he just said, legacy, is about the Tatas. If you have just seen, Ratan Tata is left, but the Tata brand name is there, so that the whole thing still goes on. A person should not be there to run the show. Even after that, there is somebody, it's a brand which has been created. Now we have another talk coming up. So thanks, Dr. Senthil, for giving us all the highlights about how to go about the practice management and the success story, how to scale. Dr. Devanshu Arora, of course, is going to speak on collaboration for success. So over to you, sir. He is a localite from very much in Dehradun, son of Dr. Arora. So he is going to really give us an idea about this. Thank you.
Thank you so much. Thank you, Dr. Senthil, for this opportunity. I will be speaking on collaboration for success. Dr. Senthil has mentioned a lot in his talk about collaboration, and collaboration is the way forward for us ophthalmologists as well. So, why collaboration matters for us ophthalmologists? Collaboration in private practice involves working closely with other professionals and industries to achieve mutual benefit. Why it's important. It helps you accelerate growth. We can expand our services, get more referrals. It helps us build reputation, enhance our credibility through partnerships, and improve patient outcomes by coordinated care among different collaborators. So first, let's look at collaborating with other doctors. We need to build a referral network, and the first and most important is to connect with general physicians. Having partnerships with general physicians, especially for diabetic cases and hypertensive cases, it can really improve your practice. So, for example, an ophthalmologist A partnered with 3 local GPs around their practice, and the result was around 25% increase in diabetic retinopathy cases diagnosed in the OPD within 6 months of time. So, the key takeaway here is that even simple partnerships can drive a significant growth in your practice. Second most important is neurologists. So partnering with neurologists for especially neuro-ophthalmic practice or neuro-ophthalmology patients, even your general ophthalmology practice, can help you a lot. If you have a visual field analyzer equipment, then the proper utilization of that can also be done, because many of the times not be utilized for all glaucoma cases and other cases. But if you're getting referrals for field analysis from other physicians and neurologists, it can help you utilize that equipment better as well. Then is collaborating with other hospitals. So the corporate hospitals are there everywhere now, and especially in the beginning of your practice, you can serve as a visiting consultant to increase exposure and credibility of your own yourself. And if you don't have a OT at the beginning, if you are starting small, you can even reduce your cost by using their surgery setup and equipment at the beginning. And for more mature and more advanced centers, there are options to tie up and run the ophthalmology department of the corporate hospitals, because for the corporate hospitals, usually ophthalmology department is not their core focus. And many of the corporate hospitals are actually willing to outsource their entire ophthalmology department to an institute. So if you have that kind of a capability, you can tie up with them, and this will help you even utilize your own staff better. You can rotate them to your center as well as the corporate hospital. There are a lot of small private hospitals who are not able to provide complete eye care services, and you can partner with them, serve as a visiting consultant. And since they might not have a phaco machine or like a IoT setup, so you can have those patients coming to your center, and you can perform the surgeries and continue the care with them. So it's a win-win for both the small hospital as well as your own practice. Then the second option is to collaborate with NGOs. A lot of us are doing that. We can conduct eye health camps in partnership with NGOs and help. This will help, that way help can do camps and serve underserved communities. This will also help you build your clinic's reputation in the long term. So most important, the one which I like the most is the corporate collaboration. So very less of us are exploring this opportunity, but there is huge potential here. So collaborating with corporate organizations is one good option. A lot of small corporate companies around your practice may be having corporate wellness programs. Their HRs departments are running corporate wellness programs, and they will be willing to partner with you for eye care services. And you can offer vision care and eye care checkup camps for their employees. So this is one of the most rewarding form of outreach because it's a win-win for the organization as well as your practice. They get to have that eye care screening for their patients and eye care services for their team members, for their employees, and you get word of mouth for your practice. Not only those employees will come to your clinic, but they may refer to their other colleagues and friends who will get to know about your hospital, your clinic, and this will help you build both business and goodwill. Using technology to expand collaborations is also one of key points in today's age. There are a lot of options. One example is telemedicine and ophthalmology. We just had a talk, an entire session on it actually before this session. And you can collaborate with a telemedicine service provider. There are a lot of, you need not build that capacity yourself. There are startups and organizations which are actually providing telemedicine services, and you can utilize their, you can have a partnership with them and offer remote eye care consultations to rural patients in your state and your region. And you can expand your geographic reach without needing to invest a lot or open additional physical locations. And need not say government empanelments are a must for any private practice in today's age or in a hospital. And the most common ones, CGHS, SGHS, state government health services, and ECHS, we all know. But also try, if there is not an ESI hospital nearby, try to have an ESI employee state insurance empanelment, which where you can get referrals from ESI dispensaries in your area. And Airport Authority of India is one more option, which we sometimes don't explore. And other options are state power corporations, state police forces, and other state and central government institutes which are there in your region. You can explore and get empaneled and increase footfall in your practice. So these government empanelments are not just to get the patients who are empaneled and treat them at a little subsidized rate. That will help you in a certain way. But those patients who come to your center via this route may actually refer other patients who are paying patients or out-of-pocket paying patients, and that will help you generate more growth in your practice. So there are challenges in collaboration we all face. One is managing expectations. We need to ensure clarity on patient referrals and revenue sharing whenever you are collaborating with any corporate or any organization, and have a standard for service standards, especially when tying with smaller hospitals. And then there is legal and financial aspects. Secure proper contracts whenever you are going for a complete partnership. Have agreements before starting any collaboration to avoid disputes in the long term. And communication is the key. Establish regular communication with collaborators to keep all patients aligned, all parties aligned, I mean. Overcoming these collaborative challenges for managing expectations, clearly define the roles, responsibilities, and revenue sharing structures upfront. Don't wait for this discussion to happen at a later date when you have already started. But be very clear in the beginning itself and keep clarity in the roles which both the parties may have. Create detailed agreements to safeguard interests and discuss profit sharing models transparently. Effective communication, as I said, is the most important. Hold regular meetings and see where things are progressing and take it forward from there. So the key takeaways in this short talk I would share are: collaboration broadens reach and expands patient services and helps you enhance your practice, grow your practice. Collaboration with doctors, hospitals, NGOs, and more importantly, corporate organization offers multiple avenues for growth for our practices, for our hospitals. And using technology will help you expand geographically, offer value-add services, and overcome these challenges through clear communication, signed agreements, and aligned expectations. So are you ready for collaboration? Take the first step once you go back after this conference. Identify one potential partner a doctor or hospital or an NGO or company, and explore how you can start collaborating. Look at your practice and assess where partnerships can enhance services and broaden your patient base, help you expand your services. And collaboration is a win-win. Start small, scale up collaborations as your practice grows, and follow this going ahead. Thank you.
Very short and sweet talk. Very important go-home messages for all the individual practitioners, especially in the rural area and even in the mega cities. You are sitting on the top floor of one of the buildings. How does the patient see there are no boards in and around? This is how we should go about. So very nicely covered each and every point. Any questions to Dr. Senthil or others, please ask. We have about only 5 minutes left before we wind up the session. So I was just, Dr. Arora, with the build-up of, say, in a tier 2 city, if a person wants to start the practice, what are the minimum equipments he should have? Tier 2 and a rural setup. Mega, to of course, we have to have a full setup to have doing very well in this.
So it all depends on two factors. One is how much financial investment are you ready to invest in the initial beginning? Do you have a capital fund? Do you have a capital fund already with you, or have you already secured a bank financing, or what kind of investment you can make? And second is the kind of market that is there in the region which you want to start. So are there already a lot of providers? Are there already corporate hospitals in your area? Or are there bigger eye hospitals around or not? But still, I would say that starting your own practice is quite possible, even at any scale you want. There's still the ophthalmology business, as we are saying that there is a lot of competition and everything, but there is a lot of demand still. Still there is underserved. You can identify those areas and start there. Having equipments, I think it depends on your specialty, but if you're starting a general ophthalmology setup, the basic is the entire OPD flow should definitely be there, and you may not initially have the cataract OT or the eye OT. You can begin with partnership with a smaller hospital nearby, utilize their services, and just have your first like screening, refraction equipments, and your team around that, and slit lamp, and complete your examination OPD setup.
Absolutely. See, there are various options which I think is very important, especially for a beginner with less of funds. As Dr. Senthil has said, you scale up slowly. So you have the skills, but you don't have the money. How do you go about it? A few general tips which I would like to share is, one is, you have a rental place, don't invest in the place initially. And you make a move around in the periphery about 30 kilometers around to, that's like an outreach program. Initially you need to do, telemedicine is of course one part of it, but unless you show your presence and your skills in the mini setup in and around about 30-40 kilometers out of your area of practice, you are not going to immediately catch up all the people on day one don't enter. That is one thing. So don't invest on the, the clinic infrastructure. Buy on the equipment, the basic equipment that you require is a very good slit lamp. Don't compromise on the things which are going to help you have proper diagnosis. So all your equipment should be the best grade. I won't say maximum price or the costliest, but it should be good enough in what is happening in your area at least. That is what I would say. What is said is regarding microscopes and else, you need not invest in the initial phase. Base OPD equipment, and lot of, say, at least I am practicing in Pune, all the other equipments, the major equipments you require are available on rentals. Something is, somewhere it is 500, somewhere it is 1000. So that you can cover it from the patient and still not compromise on the diagnostic facilities. We have the YAG laser, we have the OCT which is available, we have the optical biometer which is available on rent. So without compromising also, you can still do the practice in a top way. So that is the second tip which I would like to give. Third is, whenever you are buying a loan, try and get only the government, that is nationalized banks. So they have offer the minimum percentage of loans. A the government or a private institute is almost 1 to 1.5. So on a lakh you are paying 1,500. For an early practitioner it's quite a bit. So I would say go in for a loans where, and they try and give you maximum number of, the percentage is 80-20 or 90-10. where 10 is your percentage, that is your amount that you have to put in to get that amount of loan. So priority should be mainly on the instrumentation, diagnostics and the primary OPD. OT and this you can utilize close by hospitals, you can collaborate with one of them, they utilize their services. Of course you're going to earn a little less, but more of peace of mind, and you have enough time to scale yourself. Do you agree, Dr. Senthil? Yeah, he has got a different view. So this is my view for the
No, actually I have a different view, because just like a restaurant, you if you want to go and eat in a restaurant, you are looking at certain basic facilities. You don't want to go to some fast food kind of a place. So hospitals also now, the corporate hospitals have created a certain minimum expectation for the patient. Basically, they need to have a good waiting area, good ambience in the clinic, good washrooms, maybe a minimal number of staff. So all these are expectations of patient to get operated. So somebody like, will you take your own parent to a hospital or a clinic which is run by a part-time doctor on a second floor? I think you will take for a consultation, but for a surgery you may not take them. So if you really want to develop a serious practice, I think nowadays the practice is better in smaller towns, tier 2, tier 3 towns, but there also people are used to these Agarwal and Vasan and all these corporate hospitals which have a minimum infrastructure. So you should have at least a decent 2,000, 3,000 square feet hospital which is full time, if possible with the OT, or maybe even a OT tie-up is okay, but the ambience and the basic requirements, staff who are uniformed, and then all those things are very important if you really want to develop a good practice. Because I think gone are the days of this practice, you start with a slit lamp and then I can grow, that days is gone now. So it's not possible. Yes, sir. It's a small crowd.
I'm Dr. Yogesh Shukla. I'm retired from Government Medical College, SMS Hospital, Jaipur, and now I have my own practice. My wife is a gynecologist, so she earns the butter, I just earn the bread, you know. But yeah, you're very. What I have seen, you know, because a lot of my students have now, they are putting up their, resident nursing home. What you said is very correct, that basic ambience is very important. That's very true. They all want an air-conditioned waiting room, nice ambience, you know, nice waiting rooms. And one thing I just want to add, that staff cordiality is very important also. You know, I have seen, people going to other hospitals and they're very rude, you know, the reception is rude, the things are rude, the nurses are rude. So that training to the supporting staff is also very important. I just wanted to add this thing. Rest, what you said is very good.
Absolutely, a very nice point, sir. You have said. What I had said was absolutely no money, and then you start in a rural setup for this. But what he says is in the mid this thing and major.
I agree with your your point also.
Yes.
It is very difficult to invest immediately.
And on a day one, you have 3,000 square feet in a tier 2. You require crores of rupees.
I absolutely agree.
So
you can start on in a rental place, but that should be good, you know.
Yes.
It's not.
The ambience should be good. I do agree on all that. That's why a rental place, you have your own setup the way you want it.
Yeah, and now in Jaipur, what you said is you can have a type with a hospital where you can go and operate your patients. A lot of people, you know, in Jaipur, doctors, they have taken a LASIK, but they have contributed 6 people, and they put it at one place, and they go and do their LASIK. So that what your point is?
Yeah, that point, the way I said, rental is available, or a neutral center where we have all the diagnostics tools you have, so you don't investment on major equipments initially. Of course, as you scale up, you have your own equipments over it. So a big thank you everybody. We are at the end of the session. I would like to thank Dr. Namrata Sharma and the scientific committee for giving us the chance on behalf of all the chairpersons to conduct this session, and thankful all the intelligent participants who waited till the end of this. And we have to hand over the session to another person over it. Thank you very much, and wish you all a very, very happy Diwali. Thank you, sir. Yes, sir.